Have y'all seen this?
Why I don't see people with extra toes and fingers like I used to see? Man, when I was little, everybody had 6 toes, everybody had this gone.
Welcome to She Knows DNA. My name is Miavonna, and I am a board-certified genetic counselor. Child, in that video, Boosie was really trying to figure out where all the people that had the extra fingers and toes from that he later called a Hood Mutation. So let's learn about exactly what he was talking about, shall we? Let's get into it. When it comes to congenital birth defects, they are occurring as often as 3 to 5% of all live births, especially here in the United States. Whenever I use the term congenital birth defect, I'm referring to some type of structural change that is literally abnormal than what we expect that part of the body to look like. And it can cover a wide range of conditions or even organs. There could be defects of the brain, the heart, the bones, and in this case, the fingers and toes. There are a number of defects that can affect our limbs, but in the case of the topic of this video, when there are extra fingers and or toes, we refer to that as polydactyly. There are 3 types of polydactyly. First, there is preaxial, when there is an extra digit connected to digit number 1 that we know as thumbs and our big toe. Next is central polydactyly, and that can happen if there is an extra digit anywhere on digits 2, 3, and 4. And then last but not least, there is postaxial, which is an extra digit connected to digit number 5. Whenever it comes to polydactyly, we are not saying that that extra digit has to be on both hands and both feet. It can really be a combination of just affecting one of those or even all 4. There are multiple causes for polydactyly. The one that we usually see, we consider that familial, meaning that in a family, it keeps popping up in different members to where they have an extra finger or toe. Out of all of the ethnicities and races, African Americans are more prone to have polydactyly. And whenever you see it in the family, it may resemble an autosomal dominant type of inheritance pattern. Now, even in that case, it may look like it's skipping generations, or you may even see one person has that extra finger on the left hand, the other one has it on the right hand, or maybe even both. And it still would be considered a familial type of presentation to where it runs in the family. And that is likely what Boosie was talking about in his video. Outside of polydactyly being a familial trait, it can also be one feature, a part of a bigger type of genetic syndrome. So this can be seen in Bardet-Biedl syndrome or even trisomy 13. When it comes to environmental factors that can result in polydactyly, there's not a whole lot of specifics like there are with other types of limb deformities. But however, just think about it as the nubs or like the buds of the arms and the legs start around 5 weeks in pregnancy, and then you should see them fully formed around like the 12th to 13th week. So in between that time frame, is there if any type of teratogen or toxin that is entered into the mother and affecting the home of the baby, then that is the time frame when polydactyly or other types of limb abnormalities can occur. And last but not least, honestly, polydactyly can just happen in that one pregnancy. So that's what we call de novo. I do know that males are more at risk of having polydactyly compared to females. And so that can be something to take into consideration too, especially for those that don't have a family history of it, or they especially don't have a syndrome that's related to the polydactyly. As far as how polydactyly is treated, it really just depends on what all is involved in that extra digit. So in that video that Boosie put out, and really what many of us may see is that they have just a little nubbin is what they call it. So yes, there is that extra digit on the hand or feet, but there's not really any type of structural things inside of it. So what they'll likely do is tie a string very tight around that nubbin until it falls off. If there is an extra digit that involves more structurally sound types of things, or even if it's fully functional, that would be in need of a more invasive type of treatment like surgery. So I got a question. How many fingers and toes were you born with? Do you have a family history of polydactyly? You know, all of y'all in the family got like matching scars or something. Let me know in the comments. And now to leave you with words of wisdom. Don't trust anyone that tells you that they have known that his name was Eddie King Jr. instead of Eddie Kane Jr. Don't trust them. That is, I'm about to cuss. That's a lying spirit. I know I have to use such strong language, but go ahead and let that sit for a minute. You mean to tell me that you have always known that it was Eddie King Jr.? Deuce don't believe you either, do you, Deuce? Well, that is all I have for you this week. Thank you all so much for continuing to support She Knows DNA. Please feel free to like, comment, subscribe, leave comments. If you need me to come talk to your people, your nursing home, your church, your children, let me know. Otherwise, thank you again, and I'll see you all next week. God bless you, and may you have an amazing week. Bye.